Welcome back to the Poultry Doc Podcast. I'm Dr. Blayne Mozeshek. Today I'm jumping into the Backyard Chickens Ask the Poultry Doc forum and walking through a few of the most interesting cases from this week. We'll talk about Favus and how to recognize and treat this contagious fungal infection, a swollen eye that may point toward infectious Coryza, and some practical guidance on treating mites so you break the life cycle and not your back. These are real birds, real problems, and real-world veterinary decision-making. If you find these helpful, peck that like button and subscribe, and join us for more at thepoultrydoc.com. Let's dive in. Welcome back to the Poultry Doc Podcast. I'm Dr. Blayne Mozeshek, and today we're going to do something a little different. It's cold and rainy outside, and so what we're going to do is jump into our Facebook group page, Backyard Chickens Ask the Poultry Doc. We're going to take a look at some interesting cases, and you can see exactly how I walk through a typical day when I've got a little bit of free time. This is Ashley. And Ashley says, I've noticed my entire flock shaking their heads and scratching their faces a lot. What I thought was dirt and their faces and on their faces and wattles was actually these small little black and brown flea things that had to pry off and smash. I also noticed what looked like yellow bugs near their vent areas. So it looks like I've got two types of bugs causing issues with them. And I can just see right away she's talking about, she's got an ectoparasite problem, right? So I'm already thinking, what's going on? We're trying to identify what it is. Sounds like Sticktight fleas potentially. We'll see where they're at when she describes them more so in the pictures. Okay, so Ashley goes on to say that no one is lethargic, but there has been subtle weight loss, again, which is normal in these ectoparasite infestations, right? They cause stress, they're feeding on the blood, they're blood feeders, and so all that, if the infestation is high enough, can cause weight loss. So again, that's feeding into the picture that we're trying to create, that it's an ectoparasite issue. She goes on, I have a few things that I have on hand to treat bugs in the coop environment, but I'm not sure what the best method is or the safest ratio. So let's look at these products that she has. Permethrin, labeled for use in poultry. Depends on the product specifically. I try to look for those products that are labeled specifically for poultry, and there are poultry labeled permethrin products. Dust On, another product labeled here. It's also Permethrin, so these two have the same active ingredient, so those really aren't two different products. We'll look at it that way. Although this one is labeled for poultry, so if we had to pick one, this is one we would go with, is the Dust On. So the third product Ashley has is, I can already see really clearly, it's got a picture of a parrot, a pigeon. Pigeon is kind of the giveaway, and I recognize the store that's selling this is in Australia. It's a dead giveaway that what's in this is not likely labeled for use in the United States, number one, and definitely not labeled for poultry, so food producing animals. I have to remember that just because our chickens may be pets and they're in our backyards, the way from a regulatory standpoint, they're still considered poultry and food producing animals. So any drugs that we give them really need to be approved for use in poultry. And that protects you, one, and it protects the bird too. We want to make sure that any drug that we give, we know what we're giving, one, and two, that it doesn't have residues that could pass to the eggs, because sometimes those residues can be harmful. And it's not to say that residues never pass into the eggs, but the drugs that are labeled for use in the US in poultry also come with known withdrawal times, right? So any drug that you see or any medication that you see used in poultry or any food animal will have a specifically labeled withdrawal time. Sometimes it's 0 days and there's no issue at all to eat those. And others, 5, 7, depends on what the drug is, could be longer. So we don't have any pictures of her birds here. Unfortunately, I always like to look at the parasites and see what's going on. But just from the description, she probably has a Sticktight flea infestation as well as potentially northern fowl mites. Just she could describe that there's some residue around the vent area, and that's very classic of northern fowl mite. So really the product that we have available to us today in the US market is Permethrin to control this. Elector PSP is also available. Both of those are good products. The Permethrin-based products can be dusted on, they can be sprayed on, it really just depends. Always follow the label when it comes to treating for these. With ectoparasites, just as with any other parasite, their life cycle determines how we treat. In the case of ectoparasites, usually if we're talking about lice and mites, most fleas, the adults lay eggs, right? And then those eggs take time to develop. So we have to remember when we treat the flock, let's say with Permethrin in this case, we'll kill those insects that are alive, those parasites, yet there's still viable eggs that remain on the feathers, for example, and those aren't going to be affected by the Permethrin type products or just ectoparasitic type products that we're going to apply. It takes about 7 days for those to hatch. So assuming that an adult flea, for example, or let's say an adult mite laid an egg and then we treat it immediately after, So that egg's going to take 7 days. So what we need to do is treat again 7 days later and ensure that we kill all those parasites that were hatched after we treated the first time. It's also important to look at the parasitic life cycle, because many of these can't survive off the bird for any appreciable period of time. So for instance, like the northern fowl mite, really never, its life cycle never is off the bird. It has to be on the bird to feed. So really when you hear a lot of folks like making all this effort to clean the coop and wash and disinfect everything, it's not probably necessary, depending on the parasite, because that parasite has to go back onto the bird in order to eat, and then we'll be exposed to whatever the treatment is that we gave it. Okay, so another parasite question. So this time internal parasites. We run ectoparasites last time. Now we're talking about GI worms. So question is, does the vet recommend worming for prevention? I thought I saw a recommendation to worm every 3 months for prevention. So this really depends. Like the gold standard would be to perform a fecal flotation. So you take a sample, say 5 to 10 grams of droppings throughout the coop. That's going to be a representative sample of everybody. It doesn't need to be one specific dropping from each bird. Just go around the coop, collect a handful of droppings, put that in a bag, and you can really bring that to any veterinarian, and your vet will do a fecal flotation. And actually, they're going to be looking for the parasite eggs, not necessarily the parasite. If those eggs are present, that means you have some level of a worm burden. Now, often we will look at, if there's just one there, it may not be a huge issue, right? So that's a very small burden. It's probably not causing that big of a problem. Usually like 50 eggs is kind of my threshold to treat. If there's 50 roundworm eggs in that slide, and that's what they report, or they may give you a +1, +2, +3 score. You know, +1's probably not that severe, but something to keep an eye on. +2, +3, we definitely want to treat for that. Again, from a welfare standpoint, we don't want this heavy worm burden within the intestinal tract of our birds, right? It's not healthy. It's taking away nutrients from them, so we want to do everything we can to prevent that. Now, if you don't have access to, or maybe you can't afford to have these fecal flotations done, treating every 3 months, as she suggested, is a great plan, a prevention plan to prevent those worms from causing issues in your flock. But always, you know, if possible, we want to go with the gold standard and determine what the burden is by running that fecal flotation. Now, I'm excited to announce that shortly, we're not quite there yet, but we'll be offering these services. So you can look at thepoultrydoc.com in our marketplace and find where you can submit your own fecal samples. Another thing we're looking at offering are feather samples for like feather mites and other parasites. If you've got Sticktight fleas and want to identify them, or you're just curious about what something could be, we can send you the kit to help diagnose those, and you can send them back to us and we'll identify them. So very excited to bring that on, and stay tuned because we're going to be announcing that hopefully in the near future, start of next year. Okay, so Jane's got an interesting one. We've got an eye issue here. So we've got a chicken with a big bulging eye. Eye issues are very common in respiratory disease in chickens, and so it can present in several different ways. With mycoplasma, we see the bubbles in the eyes that are very common, and the eyes crust over. Facial swelling. Coryza is more consistent with really large kind of bulging eyes, and what happens there is that infection gets around the eye, and the way the chicken immune system works, it tries to wall that infection off, and it basically, instead of having pus, they just have this hard cellular debris. We call it inspissated cellular material, inspissated pus, which means basically just dry and hard. So in this case, with this chicken, what we're going to have to do is remove that material around the eye. It looks not fun. And so what I would suggest here, you're going to apply pressure from the outer margins of the eye, pushing down and then towards the middle. And you'll feel this is mobile. It's not stuck to anything, this hard cellular debris. And you can actually get it out through the opening of the eye, around the eyelids. Once that's out, this chicken can probably clear this infection. Obviously, systemic antibiotics would be helpful. I mean, in this case, I'm not sure she'd be able to get those, and we'll make that recommendation. But one of the things that, you know, I'm going down here, always be careful with what you do and who's commenting. Somebody's recommending boric acid, right? I don't even know why you would want to put boric acid in the eye. Remember, the eye is a very sensitive organ, especially to pH. Actually, all ophthalmic products, the reason what makes them different from others is that they're pH balanced. And so like a pH of 7.4 of anything you apply to the eye, when your eye burns because you get something in it, it's most often associated because the pH is off. And so anything, again, that we put in the eye, we want to make sure that it's labeled for ophthalmic use. So terramycin is one that's actually cited in the comments, and while that's not going to hurt, in many cases, yeah, this is an infection in the eye, but there's probably some infection going on somewhere else. So this particular chicken would benefit from a systemic antibiotic. Okay, so here's an interesting one from Granetta, and I've actually seen this come up relatively often just in the last few weeks. So obviously this is a seasonal issue, and it's referred to as Favus or chicken roundworm. It's a fungal issue, just like roundworm is an issue in kids or people. It can be associated with a depressed immune system. Kids, their immune systems aren't fully functional yet, so it happens more often in kids. But just like roundworm in people, it's also contagious. So if your chicken has this, be sure you treat it appropriately, wear gloves, wash your hands, do all those things. But what Favus is, again, it's a dermatophyte, so it's a fungus that grows on the skin. You'll notice it mostly around the head, so wattles and combs will have it, and they have this like chalky, whitish appearance. In this particular case, it's a turkey, which is unusual. I mean, just that I've not seen it before. But it has all the features, right? It's all on the snoot and the head, and it's very white and crusty. The one thing that doesn't quite fit the picture here is this turkey's got a very swollen face, swollen head, and this could have been going on for a while, and maybe it's involved, there's some other infection, secondary infection going on. So in the comments, there's plenty, there's like 68 comments in this particular post, and many of those in the beginning were suggesting that this was pox, and it really doesn't look anything like pox. Pox is like dark, scabby, pustule type lesions. So I basically said, no, this isn't pox, and this looks like white chalky lesions consistent with Favus, more like a fungal infection. I suggested in this case, just like having the others, that applying, again, this is the one time where I probably suggest using Monostat. So an antifungal cream like Monostat, it's a great solution for this particular issue. Apply that twice a day until those issues resolve, until you see the white crustiness go away. You may go a couple days longer just to make sure you've gotten everything, but Monostat for Favus is a good one. So I also mentioned that the facial swelling here is unusual for Favus, and so maybe there could be two things going on. Again, those fungal infections, dermatophytes, they kind of tend to attack when the immune system is depressed. So seeing or having the stress of like a respiratory infection and then that followed by Favus isn't uncommon. We see it more in the wintertime. Again, the stress of winter can bring on those dermatophyte infections as well too. So this turkey also had facial swelling too, and that can be associated with mycoplasma disease, but it may just be a reaction to the Favus. Now, mycoplasma in turkeys is pretty severe, and they don't feel really well, and I can't see a video of the bird, but she seems to be all right. She's standing and not too depressed. Granetta did respond back. She's concerned because none of the other birds are showing any symptoms of this. So then we've kept her quarantined. She does have a respiratory sign, so maybe it's mycoplasma, and she's asking for a remedy for this. So if this is just Favus and we're not seeing it in the rest of the birds, remember that stress alone can bring this on. So obviously certain individuals in the flock may have more stress than others, so it's not completely unusual to see it in one. Now, it is very contagious, and so others could get it, so we still want to keep her quarantined. But the good thing is the antifungal treatment, the Monostat, seems to be working. She responds that she's gotten her color back and seems to be quite a bit more active, which is great. I'm glad to hear that the Monostat is working. And she's asking what else she can do to speed up recovery and get the swelling down. So it sounds like while the swelling has gone down a little bit, it's not completely resolved. If her activity's coming back and she's getting around very well, and the miconazole cream is working and resolving the Favus, I think time is the best solution here. I'm always one to be more hesitant to give antibiotics in this case, what would be needed for mycoplasma. So my suggestion to Granetta is going to be, let's let this heal, let's let the Favus clear up, and then if she's still having some respiratory issues, if we're still hearing respiratory noise, then I would suggest that this turkey be treated for potentially mycoplasma, which we could test for. Thanks for tagging along with me today, where we got to jump into the Poultry Doc forum and check out a few interesting cases that are coming through. Now, as the Facebook page grows, which is super exciting, we've got well over 20,000 members. It's hard to believe we started 6 months ago and we've already got that many. There are cases that make it through the cracks. I just don't have all the time to get to them. But we've got a great offering that we launched a couple weeks ago called the Founding Feather. If you go to thepoultrydoc.com, you can find more about it, about the subscription and what it offers. And it's a white glove service, and really one of the main things about it is it provides 2 hours of consulting time over the course of the year where you and I can talk about your flock and talk about your issues and many different ways that I and the team at the Poultry Doc can help you. So again, go to thepoultrydoc.com. That's the Founding Feather, and we've got other subscription tiers rolling out as well as we enter the new year. There's a marketplace that's coming. There'll be vaccines there. There'll be the fecal flotations that I mentioned earlier and mite evaluations, all sorts of things that are coming to the market. in addition to some really great products that have science behind them. They're data-driven and factual, so you can find really good information. So you can sign up for free right now, and that will give you access to our newsletter and keep you up to date on all the interesting and exciting things that we've got coming for 2026. So you can look at our symptom checkers there too. That's an exciting tool that if you've got some issues going on in your flock, you can work with that and hopefully try to figure out what's going on. So again, poultrydoc.com, go sign up and stay tuned to what's going on. Thanks for joining today.